Well, San Antonians suffering from knee and joint pain or peripheral neuropathy from diabetes can't stop talking about Cedar Hills Family Practice. Here's why they say you should stop by.
He made me feel better that the injections on each one, I had 10 injections on each leg, and I can walk better.
I got a lot of faith in him because what he did to me is wonders, a miracle.
After the 5th treatment, I started feeling, boy, I can walk better. Dr. Williams, very considerate and goes out of his way to treat his patients good.
Well, you just heard from a couple of the patients here at Cedar Hills Family Practice, and joining me is Dr. James Williams, who's been helping a lot of the patients here as far as knee and joint pain and as well as other things. But let's first talk about that, doctor. Knee and joint pain, what have you been doing to help your patients?
Well, obviously, we need to completely evaluate the patient before we decide what kind of treatment we need to go through. We can do a complete physical evaluation with x-rays and laboratories and all kinds of different modalities to help figure out what's causing the joint pain before we proceed with possibly injections or further evaluations and referrals to different doctors.
And I had 10 injections on each leg, and I can walk better.
You say injections, and I've been hearing too from your patients that this is what they've been receiving, correct?
Right. Hyaluronic is a compound, and there's various different ones that people use nowadays to inject into joints. Basically, it's a form of a compound that we have in our bodies. Basically, a knee joint, over time, this compound erodes and it becomes bone on bone. What we do is we inject that back into the joint, and it separates that joint space again, so no longer is it bone on bone, and a lot of the pain will go away.
He put a shot there, and believe me, I felt so relieved.
Your patients have been saying it is almost like a miracle has happened.
And I can walk better.
I really appreciate being able to help these patients, and I'm looking forward to helping a lot more.
Yes, and this machinery that we have here, this is also part of their treatment, correct?
Well, we use it to guide the injections into the joint space, making sure that we're in the right place where the injections goes and verifying that the injections are going in there.
One other thing, that every time we come here, we also talk to you about diabetic neuropathy treatments. Tell us a little bit about that again.
Diabetic peripheral neuropathy is a problem that diabetes basically kills the nerves in extremities, and the treatment that we have will basically bring back the functioning of those nerves, get rid of a lot of the pain, the numbness, and problems with walking that a lot of the patients with diabetes have.
I was looking some cure for my nerves that was really damaged and affected because of diabetes. When I came to this clinic the first time, I was using a walker. I was not able to walk by myself. So after that, I was using a cane. Now I'm walking by myself.
The kind of pain that they're going through, like you mentioned, numbness, tingling feeling, can't sleep at night, that can be really excruciating.
Yes, it's one of the worst problems that the diabetics have, and it limits their ability to get around, and limits their ability to have a good sleep. It really impacts the quality of their life significantly, and the treatments that we have, it will help that significantly and help them regain some of their functioning that they had when they were younger, before they had diabetes that affected the nerves.
Once again, Cedar Hills Family Practice, you're located on Southeast Military Drive.
Yes.
Okay, so be sure to stop on by here, and you also have a phone number.
Yes, it's 298-4711.
Okay, and also check out the website, cedarhillsfamilypractice.com. Thank you so much for having us once again.
Gracias.